Anybody know where Regina went to? All right, we'll call the Senate Finance Committee meeting to order. Do I have a motion to go into executive session?
So moved.
We have a motion and a second to go into executive session. All those in favor say aye.
Aye.
All those opposed say nay. The ayes have it. We are in executive session. First bill on the list is CACR 12.
We'll move on past and CACR 12.
Let me get to it here so I can keep my notes there. All right, Senator Lang moved and Senator Pearl seconded. Discussion? Senator?
Thank you very much. In 250 years, except for 2 years, I think, we've never had a broad-based tax. And every tax that we do have was enacted by Republicans. So it makes me wonder if you don't trust yourselves. I will not be voting for this motion. I just don't see why we should be trying to handicap the future. Who knows?
Senator Waters?
Thank you, Mr. Chairman. Just to reiterate, while I'll be voting no, and for these reasons, but also in part because I think the word scheme is inappropriate in legislative language. And also, I think that I feel as a senator, in addition to the Senate, there's something deeply undemocratic by not trusting us to represent what our voters represent, and what we can vote on as we vote on everything else, except for constitutional amendments. Thank you, Mr. Chairman.
Further comments? Senator Lang?
So remind, we're not voting on, we're going to create a 2/3 requirement. What we're voting on is allowing the citizens to the state of New Hampshire to make a decision on whether that's an appropriate requirement for before the institution of a broad-based tax. So I think this is democracy at work, direct democracy, going right to the voters, asking them their opinion and letting them set our how tax policy be addressed in the future. So I'll be voting in favor of this bill.
Further comments? Senator Rosenwald?
Yeah. I mean, our constituents for 250 years have been electing people who don't pass broad-based taxes. I've been in the Senate for 8 years now. I've never seen a bill in the Senate for an income tax or a sales tax. I think it's very clear the public doesn't want them, and I just don't see any proposals. Thank you.
Further comments? Seeing none, all those in favor ought to pass, say aye. Aye. All those opposed, say nay. Right, that's a 5-2. Okay, and who wants to take it out?
I'll take it up.
We still have a couple of minutes, 4:07.
I'll move interim study on House Bill 407.
Second.
Yeah. I'm gonna stay.
He's the road runner.
I haven't even gotten the right page in my book yet, so. Okay. Did you want to speak?
No, again, Mr. Chair, I think the concept behind this bill is one worth pursuing. However, giving all of our states of revenue an unknown going forward, I think we probably just want to interim study it and see where we're at.
Okay. Discussion? Seeing none, all those in favor of interim study say aye.
Aye.
All those opposed say nay. The ayes have it.
Move consent.
Move consent. Senator Lang, Senator Pearl. Okay, all those in favor of consent say aye.
Aye.
All those opposed say nay. Ayes have it, and I'll take that one out.
You want to?
Yeah, 604 is the next.
Second,
I have a motion of
604 at the bottom.
who seconded?
I did.
Senator Lang seconded. All right. Discussion. Seeing none, all those in favor of minimum study say aye.
Aye.
All those opposed say nay.
Nay.
And that's a 5-2. And Senator Pearl, you want to take this one? Since you made the motion.
Assuming consent is off the table.
I'm sure.
Okay. Do I have a motion to come out of executive session?
So moved.
We have a motion second to come out of executive session. All those in favor say aye.
Aye.
All those opposed say nay. The ayes have it. We're out of executive session. And we're ready to hear our first bill. Senate Bill 662. Ready? Okay. Senator, if you'd introduce yourself in the bill.
Thank you. Mr. Chair, members of the committee, for the record, my name is Senator Howard Pearl, and I reside in District 17 in the beautiful town of Loudon. I'm here today to introduce Senate Bill 662. This language may look familiar to you. This is an issue that arose and I was made aware of in late November after bill filing, so I filed this as a late bill. In the previous budget, we had allocated $1 million to the project at the Northwood Meadows Dam. Inadvertently, at the end of the last budget, the funds were allowed to lapse. And we do have a member of, Seth Prescott is here, and he'll kind of speak to the details of the project. But what we're looking to do is get the money back. They have all of their work done and ready to go, but they found out they didn't have any money. So we are back here. I'm asking for this. I realize that we have, a challenge on revenue this time around. So I am asking that we pass this bill and we can hold on to it and see what our revenues look like. And hopefully before the end of the session, we can find some money to do it. So that would be my ask. Thank you.
Questions from the senators? Seeing none,
Thank you, Mr. Chair.
thank you very much. There is no one on the sign-in sheet. So I guess it didn't matter whether I got it or not. Anyone change their mind and want to testify? Okay, seeing none. Online, we have 2 in support and 1 opposed. Okay, and with that, we'll close that public hearing. And we still have some time before the next one. Hold this one. This one back on the table. And second, going executive session. All those in favor say aye. Aye. All those opposed say nay. The ayes have it. We're back in session. All right. We just did 4-7, 4-19. 419 is the next one on the list.
Mr. Chair, I'll move interim study on Senate Bill 419.
We have a motion of interim study on 419. Senator Ennis seconds. Yep. Senator Lang, seconded by Senator Ennis. Interim study. Right. Discussion. Seeing no discussion, all those in favor of interim study say aye.
Aye.
All those opposed say nay.
Nay.
Okay, that's a 5-2. And Senator Ennis, I'm gonna let you take this one out. And 483, you don't have to get there because we'll leave this one on hold for another week. We've been told that we cannot transfer any more TANF funds the way we are now. Senator Lang had one more question that he wanted answered at least, if not more. So that one will stay on hold for a week at least. And Senate Bill 484 is the next one. And when we get the high sign, we continue.
She went from Deb.
Senator Rosenbaum moved ought to pass. Do I have a second? Senator Waters seconds. Discussion.
Yeah. If I may. Congressional action made the work of our legislature short-term and a needless expense that can only last for a year and a half. So also, I was very happy to hear the governor say the other day in her speech that she protected Medicaid. And I'd say if we really want to protect Medicaid, we should not be moving forward with initiatives that we know, based on the experience of other states, will lead to disenrollment. And if we are thinking about why disenrollment is bad, we can look at the mental health crisis, the drug abuse crisis, and also understand that people with private insurance will end up paying higher premiums as people are kicked off of Medicaid because they are still going to get sick and they are still going to get health care, but the providers will not get paid. Those costs will be shifted on to the rest of us. Thank you.
Further discussion. Seeing none, all those in favor of ought to pass say aye.
Aye.
All those opposed, nay.
Nay.
Nay. All right.
Move
motion
ITL.
Fails. ITL is the next motion. Senator Lang and Senator Birdsall. Discussion?
Mr. Chair, we know we had a struggle with revenues. This is, if we were to pass this, it would create another $23 million hole in the Department of Health and Human Services. I don't think they can afford to take.
Further discussion? Seeing none, all those in favor of ITL say aye.
Aye.
All those opposed say nay.
Nay.
The ayes have it. 5-2. And Senator Birdsall, you want to take this one? What am I doing? I still got time.
6 minutes.
488.
Move on to pass.
Second.
Senator Birdsall moves on to pass. Second by Senator Lang. You set, Kevin? Okay. Discussion. Senator.
Yeah, just as I mentioned in our previous conversation, I think that this perhaps overly cedes the authority of the legislature in terms of negotiating a budget after a veto, particularly on line 8 when it says 3 times instead of 2 times. Then also, it seemed to me a rather odd, some rather odd omissions from the departments that would be covered, because there seemed to be, to me, to be some that would be important to continued services, but they're not mentioned here. So I don't think this is ready to go, and I'll vote against it. Thank you.
Further discussion? Seeing none, the motion is ought to pass. All those in favor ought to pass, say aye. Aye. All those opposed, say nay. And the ayes have it. And Senator Birdsall will take it out. Okay. 541.
I'd ask we hold that, Bill.
Yep.
What did you
Hold it.
We're still looking into water issues, and that therefore this may be subject to further discussion. All right, 600 is the next one I've got. And 600, we're going to hold on that. And the governor's office did come down and talk to me, and I've heard conflicting reports from other people about what the governor's office has told them. So I want to check that out before we do anything else with 600. Unless you guys overrule me, that's the way it's going to be. 601.
Move inexpedient to legislate.
Second.
Wait a minute, I thought you were holding 600.
No, 600.
Yeah, this one and this one.
Are you ready, Deb? Okay, Senator Lang moved ITL, Senator Birdsall seconded it. Discussion. Senator Rosenwald.
Thank you. I realize this has a large price tag. I think the expectation is revenues are going to pick up. Senator Lang said that last week, I believe on the Senate floor. This is one of the very few ways we can guarantee property tax relief, because enacting this would send a smaller bill to the communities. So for that reason, I won't be voting for the idea.
Okay. I did want to make a comment that we still have a lot of back of the budget cuts that we've put on Health and Human Services and other places. And certainly, before I would entertain doing anything else with this one, which would set a precedent going forward again, that there would be an expectation that this would continue on into the future. For those reasons, I can't support the bill and will support the ITL motion. All right, any further discussion? All in favor say aye.
Aye.
All those opposed say nay.
Nay.
And 5-2, and I'll take that one out. All right.
Senate Bill 602, Mr. Chair, I'd make an ITL recommendation.
I'll second that.
Lang and Innes. 602. Yep.
ITL.
ITM. 602 is withholding state payments to federal government in response to suspended federal aid.
So, Mr. Chair, so again, I consider this a spiral downward bill. We're going to withhold money from the federal government, who's then going to withhold more money from us, so we're going to withhold more money from them. In the end, nobody has any money, and we can't do state government. So again, I don't think this is a the proper way to go about budgeting and managing our delegation at the federal level.
Further discussion? All those in favor say aye.
Aye.
All those opposed say nay.
Nay.
661. Okay. Do you object to consent, Senator?
I don't know if Senator Perkins will want to speak about it. So.
This is your decision because
Pull it off.
she's not here and you are.
Consent, she can
And she can pull it if she wants to pull it.
Move consent.
We have a motion for consent from Senator Lang. Senator Bartzel beat you in that. All in favor of consent, say aye.
Aye.
All those opposed, say nay. Then,
That doesn't mean it can't go. Yeah, it has to be done. We
I'll move when we consider the consent bill.
I don't think we need to reconsider because the chair didn't hear it clearly. All right, so we're voting, the chair was in doubt. So we're gonna, to do the consent, all those in favor of consent, say aye. Aye. All those opposed, say nay. All right. All right, who wants to take that one?
Okay.
Right. We're doing, okay, pass the time. Do I have a motion to come out of executive session?
Second.
We have a motion and a second to come out of executive session. All those in favor say aye. Aye. All those opposed say nay. The ayes have it. We're out of executive session and we're ready to hear our next bill. And, okay. Thank you. All right. He'll help you. The sheet for the hearing notice. We're gonna start no matter what that sign says. Senator. Our next bill is 66663 and would ask Senator Rosenwald to introduce herself and the bill.
Thank you very much, Mr. Chairman. For the record, I'm Cindy Rosenwald, Senate District 13, which is most of Nashua. And I'm pleased to introduce Senate Bill 663, which will both appropriate some money for this fiscal year to help stop an emergency in the nursing home sector, as well as direct the HHS Commissioner to convene a working group to examine our rate-setting methodology. Our current methodology takes into account previous costs of a nursing home, resident health acuity, and budget neutrality. Budget neutrality requires the state to cut spending to nursing homes as nursing home costs rise. And this requirement, I think, is particularly Byzantine. It affects all nursing homes, but especially the private ones. So Section 1 of the bill requires the commissioner to convene a stakeholder group and report any recommendations on changing reimbursement policy by the end of the year. The department sets nursing home rates twice a year. And in January, nursing homes realized there were going to be devastating reimbursement cuts. The fiscal committee at one of our recent meetings transferred $2 million within HHS to nursing homes. This was incredibly helpful, but it didn't stop the hemorrhaging. 34 nursing homes, including 10 of our county nursing homes, still ended up with substantial rate cuts on January 1st. There's several reasons, I think, why we really need to make sure we have a viable nursing home sector and prevent losing more nursing home beds. Medicaid pays for more than 60% of nursing home care in New Hampshire. For seniors who meet both the financial and the medical eligibility criteria, nursing home care is an entitlement. Home and community-based care is not. If nursing homes, most of which are privately owned, some are for profit and some are not for profit, cannot cover their costs when losing money from the largest payer for care, they face several choices, all of which have an impact on our healthcare system and our people. First, they might close altogether, as a 45-bed facility in North Conway recently did. Secondly, they might close units to save money on staff and supplies. Both of these scenarios will result in patients remaining in hospitals beyond the point where they need hospital level of care, because there's not a nursing home bed available and no other safe place to discharge them to. The end result of that is a financial drain on hospitals who stop getting paid for the care, and a lack of available hospital beds for patients who do need to be there. And I know we've all gotten complaints about patients waiting in ERs or hallways because no bed is available. But the third result is the worst, and the one that for me is morally wrong. That's when nursing homes have to cut staff and residents receive less direct care, jeopardizing their already fragile health. And this is a movie we've seen before, beginning 15 years ago during the Great Recession. At that time, nursing homes were forced to reduce staffing, and the impact on residents was really hard. We heard from their families. Someone who needed help to get out of bed or go to the bathroom would ring the call bell, and it might be hours before it was answered. And I'll leave you to imagine the rest of that. So Section 2 appropriates $5 million of general funds for this fiscal year for the commissioner to pay out to nursing homes that experienced a rate cut of more than 5% on January 1st. It's solely the commissioner's decision how to divide up that money. I had hoped we could simply adjust rates and get a federal match, but going back to Section 1 of the bill, our rate setting methodology won't allow us to do that. So it has to be solely general funds. This amount of money, which I don't want to say I pulled out of the air, but I came up with, will not entirely solve the problem, but it will help. I was really pleased and comforted the other day when the governor stated in her speech that she was committing to protecting the vulnerable. We are talking about the oldest and the frailest of Granite Staters, people's spouses, their parents, their grandparents. Surely they are among the most vulnerable. So I hope the committee will agree with me that we must do what we can to ensure their safety and well-being. Thank you, and I'm happy to answer questions.
Questions from the senators?
Especially if it's about Byzantium.
Seeing no questions from the senators, thank you very much.
Thank you.
HHS, come on up.
For the record, Henry Lippman, the state's Medicaid director. Wanted to, in terms of the looking at the rate setting methodology, I think that that's something that we don't have any objection to in terms of looking at that. I think though, the venue to do that, I think in terms of the, we have a state, county and finance committee that's already established in statute. I think having that occur within that, which is a public open process, you know, involving the types of people that are in section one or not, it's not something that we think is a bad thing. I guess suggesting that as a venue for that to happen, since it's already established, and the fact that counties provide substantial funding towards nursing facility rates, I think there's a established venue for that to occur. I think that the other thing I would say, just in terms of the funding aspect of this, and I think the chair spoke to this a little earlier on some of in the executives trying to be solved simultaneously here, and understand that I think more time has to go by to see where we are in terms of solving the things that are already out there to be addressed.
Questions from the senators? Seeing none, thank you very much.
Thank you.
Mr. Buttrick.
Good afternoon. I'm Brenda Buttrick. Thank you for taking the time to
Oh, it's
listen.
Brenda instead of Brendan.
I'm sorry, it's
That's,
Brenda Buttrick. Yes.
I thought I had two. Anyway.
So I appreciate your time this afternoon. I'm the administrator at the St. Francis Rehabilitation and Nursing Center in Laconia. We are one of the first 2 nursing homes that Catholic Charities New Hampshire opened in 1948. Today, we are among the 7 that it operates. So we support Senate Bill 663 and thank our Senator Tim Lang and others who are co-sponsors of this bill. Only 1 of the 7 nursing homes operated by Catholic Charities did not take a Medicaid cut on January 1. The cut for St. Francis was just over 9%, or $24.43 per resident per day. It was not even the worst of the Catholic Charities system, and in each case, the cut occurred where care costs are rising. I know I probably don't need to tell you how hard it is to recruit and retain good nursing employees, but it certainly costs money to make sure that they can have a wage that they can live on and also afford housing. Because of the budget adjustment factor, nursing homes are not paid their full Medicaid rate, even when no formal cuts occur. As a result, Catholic Charities does lose millions of dollars in nursing home care, which takes resources away from the rest of their nonprofit mission. These cuts are severe, as high as over 14% at the Ward Health Center in Windham, New Hampshire. Senate Bill 663 would provide help from those Catholic Charities facilities like St. Francis, Mount Carmel, St. Anne's, St. Vincent de Paul, and Ward that were especially hurt. I'm also a registered nurse, and I can attest to the quality of care that Catholic Charities does provide. However, our mission of serving New Hampshire seniors in nursing homes is jeopardized by our current rate system. Senate Bill 663 would also require that the system be examined for improvement, and we support that also. Thank you for hearing me, and I would appreciate if you could pass this bill.
Questions from the senators? Senator Lang.
Brenda, thank you for hosting me at the St. Francis. They make great meatloaf, by the way.
All right.
Thank you.
Okay, thank you very much. You're all set.
All right.
All right. Senate rules. All right. That you're not supposed to repeat things that other people say. All right. You can say, I agree with whatever, but you don't need to give me all the details that other people gave me. We're encouraged to talk to us and not to read from your prepared statements, because you can hand your prepared statements in it. And as far as I know, all of us senators you do have the capability to read, okay? So with those, we'll start down through the list. Mr. Williams.
Mr. Chairman, if possible, I would defer to the administrator of the Rockingham County Nursing Home. She needs to get back to her facility and she can have an opportunity.
If she'd like to come up first, I'm not going to object.
Thank you, Mr. Chairman.
And your name is?
Chantel Jacome.
Okay. Where are you on my list? Okay. Would you give her one of the lists so that when she finishes, she can write her name? Because I have no way to know how to spell it.
It's an easy one.
Here. Have her sign in on that one afterward. Go ahead.
So first, I want to thank you for allowing me the opportunity to speak to all of you today. On January 1st, our Medicaid rates took a daily cut at Rockingham County of $26.43 to our care funding. To put this into perspective, we have roughly 91 Medicaid residents, which is about 64% of our total population. The impact to Rockingham County is a cut of about $67,000 a month for the 6 months until rates are recalculated. Even before this cut, we were experiencing challenges that all nursing homes have, including the cost of the food costs going up, wages going up, the impact that that has had for our center, even with offering different higher rates. We offer our LNAs, sign-on bonuses. We have 51 beds offline in a waiting list trying to come to our center to receive care, that because of staffing and trying to stay competitive, we're unable to utilize and offer to support our county. With that, we still struggle for LNAs, for nurses, to provide the care that we're known for and to support our county. With that, as we were the worst impacted nursing home of all of the impacted nursing homes with the cut, and the difference for the shortfall impacts us in our expenses. And again, we are taxpayer funded. Senate Bill 663 would help Rockingham County by covering some, if not all, of the 9.11% cut. And it would also set up a working group for the reimbursement system.
Questions from the senators? Seeing none, please do sign in over there so that we get the spelling of your name correct. All right, Mr. Williams, back to you.
Thank you, Mr. Chairman, and thank you for the courtesy of letting Chantel go first. For the record, Brendan Williams, President CEO of the New Hampshire Healthcare Association. I will not, per your admonition, repeat what has been said before. We very much appreciate this bill. We appreciated the work of the Legislative Fiscal Committee in shifting the funds that were unspent from the contract that you had appropriated monies for to process Medicaid pendings. That reduced the number of nursing homes that were impacted by January 1st rate cuts from 51 to a number that's in the 30s. There are still 13 facilities that experience what I would call pretty severe rate cuts in excess of $10 per resident per day. And this bill would really triage and help those facilities that are most impacted, those facilities that took a cut in excess of 5% of what their July 1st rates were. To put things into perspective, things started off auspiciously with the appropriation that you had given nursing homes in the 504 account. On July 1st, there was a 2.4%, maybe I think 2.45% increase on average for nursing homes. Every rate cycle, there's always going to be some winners and losers. That's a product of the rate methodology, which is really designed to, on a certain picture date, measure the medical needs of the residents in a facility. But typically, you might see a dozen facilities with their rates go down a bit as a consequence of that. Instead, as was related earlier, we saw initially 51 facilities that were going to get cut, and now we've reduced it to a number that's around 33. So still very severe cuts. The average rate increase, even with that fund shift on January 1st, was 0.01% or 2 cents per resident per day. I think you can imagine that with the cost of everything, sort of going up, whether it be wages, and nursing homes have led all healthcare sectors when it comes to raising wages and benefits since the COVID-19 pandemic hit, or whether it be the cost of feeding the residents. You know, all those things have gone up certainly, and will go up by more than 0.01% from January 1st to June 30th. I think the good news is that you had the prescience, and this was within the governor's budget too, to allocate more funds for the next state fiscal year. So this would really provide a bridge to get there for those facilities that are hardest hit. Among those facilities is Holy Cross Healthcare Center, which cares for the Sisters of Holy Cross, who are represented behind me here today. They took a cut of around $31 per resident per day, about 12% of their care funding. And it's that type of cut that really this bill would help address. And then I think also importantly, what this bill would do is establish a working group to examine the nursing home rate methodology. It has not been examined in my time here, which is going to be 10 years come May. I think that's overdue. We are the second oldest state. We actually have, if you look at the indicia of age in nursing homes, one of the 4 oldest nursing home populations in the country. So how do we make that sustainable? As Senator Rosenwald said, we saw for the first time in 8 years a nursing home close last year. It was a 45-bed facility in North Conway, a nonprofit. And so how do we keep nursing homes going? And I think this bill is really, an answer in terms of moving us forward. And I very much appreciate your time. I'm happy to answer questions, and I will submit written testimony.
Questions from the senators? Seeing none, thank you very much. Malcolm Dean.
Thank you, Mr. Chair. Thank you, Mr. Chairman. I'm not supposed to repeat anything from other folks.
You can agree with them,
Okay.
but we ask you not to repeat it.
I won't. Well, my name is Malcolm Dean. I'm the administrator at Maple Leaf Healthcare Center in downtown Manchester. We are a 114-bed facility. We support Senate Bill 663. Our cut was a little over 9%. We are part of Matera Healthcare. There's 2 other facilities as well, another one in Manchester and one in Epsom Healthcare Center that had rate decreases as well, but not as many. Matera Health is a newer company, so it does affect us in a little bit different way because as a new ownership group, the state gives facilities a statewide average rate for 2 years when they change ownership with no extra compensation for actual patient care if your patient care costs exceed that state average. And if our actual patient care costs were paid, Maple Leaf would have got a large rate increase on July 1, as would have the other 2 Matera centers. Instead, all 3 suffered rate cuts. We have 70 Medicaid residents, so we are very largely dependent on Medicaid for our current patient population. And like everyone is saying, everything else has gone up, and expenses continue to increase with reimbursement decreasing. But the funding in Senate Bill 663 would help Maple Leaf and our other 2 sister facilities as well. And we ask for your support. Thank you.
Questions from the senators? Seeing none, thank you very much.
Thank you.
Looks like Chuck from Salem Heaven. I'm thinking it might be Chris or Cross.
Good afternoon. I'll work not to be repetitive as well. So,
Good.
good afternoon, Mr. Chairman, Mr. Vice Chairman, Senators. My name is Chuck Crush. I'm the administrator and CEO of Salem Haven Nursing Home in Salem, New Hampshire. We are a non-for-profit home, and we can serve up to 110 residents. My apologies to the committee. That was bad timing. I'll try to recover from that by being brief. We support Senate Bill 663. Our facility took a 2.19% Medicaid cut on January 1st, or $5.95 per resident per day. This is not as bad as other facilities. It still hurts. We're a non-for-profit. Our goal is not to post profits to investors or anything of that nature. Our goal is to certainly serve the citizens of Salem and surrounding areas. For some time, it has felt like the nursing home reimbursement has kind of gone in the wrong direction despite the good intentions of senators like you. We certainly appreciate Senator Abbas. We've worked on the issue of the pending Medicaid issue and the pending Medicaid applications. Right now, I have $600,000 in monies owed to me by the state of New Hampshire in pending Medicaid, which makes cash flow and daily operations quite a challenge. We do thank you for appropriating money to DHHS for the private contractor, and we hope this works out and are anticipating a good solution around this topic. This bill would certainly study the shortcomings of our nursing home reimbursement system and methodology. It would certainly hopefully make it more predictable, more sustainable. As it's been said, we're the nation's second oldest population. We certainly hope you pass it. Thank you for your time and service to the citizens of New Hampshire.
Questions from the senators? Seeing none, thank you very much.
Thank you.
Melissa? And I will need that other sheet back now.
Hello, my name is Melissa Castor. I'm the administrator at Alpine Healthcare in Keene, New Hampshire. I am a native of New Hampshire who came up through the nursing home facility world, starting out as a social worker, hoping to be able to help the seniors in my community. Moving along into being the administrator, watching what is going on right now with our nursing home rates. Alpine is one of the largest hit facilities in the state. Right now, we are facing an 11.85% reduction, equal to $34.49 per resident per day. During the picture window, we were looking at a 64% of our residents were covered by Medicaid, which would be greatly impacting. If we were to look at today's rates, we would even be higher than that 64%. We are budgeting and working to keep staff wages, to keep those resident care needs met, to take and give the highest medical support to our very complex seniors that we have. The Senate Bill 663 would offer much needed short-term relief to our facility, as well as many other throughout the state, absorbing the significant cuts while we all continue to care for our vulnerable residents. I respectfully urge you to pass Senate Bill 663, and I thank you for your time and consideration.
Questions from the senators? Seeing none, thank you very much. There are 9 additional people who signed up in favor, did not ask to testify. There was 3 people who signed up online, but at least one of those has testified here today, and they were all in support. Anybody that needs a nickel back? Seeing none, we'll close the public hearing and we'll open the next one in just a minute. What, nickel? That's an old expression. Maybe it's a Midwest expression, you know, see?
I think it could be. I was familiar.
See?
Southeast Ohio, West Virginia, maybe. You know, it's easier to look at out here than
The next one is mine?
I think it might.
I have my running shoes on, Mr. Chairman, going back and forth between here and judiciary.
Our next bill is Senate Bill 661, and we have the prime sponsor here to introduce her bill and herself and her bill.
Thank you very much, Mr. Chairman. Good afternoon, members of Senate Finance. For the record, my name is Sharon Carson, and I have the pleasure of representing Senate District 14, comprising the towns of Londonderry, Hudson, and Auburn. And I have for your consideration this afternoon Senate Bill 661 relative to pooled risk management program. Mr. Chairman, I'm sure you remember this bill was filed last year. Unfortunately, it failed because of changes that the House made. But I decided to bring it forward because of what happened this fall concerning school care. And I went back and I took a look at the report, the hearing report, which is dated March 4th, 2025. And I thought something in here that I thought was really interesting, because as you know, there was opposition to this bill, and I just wanted to bring this to the committee's attention if I can find where it is. I had it marked, and this was testimony that was provided by School Care, and it says the packet from Hua Lee's testimony shows that School Care is operating within the terms of the proposed legislation, which led us to believe that everything was fine. Well, come to find out it wasn't fine, because a few months later, my district, the town of Londonderry, received a bill for $2 million because of a shortfall within school care. And this is what this bill is trying to stop. These bills. And my district wasn't the only one. There were many districts around the state who got an unanticipated bill from School Care because of problems with their program. So I'm just going to go, I have some points here, but I just wanted to give you some background as to why I brought this bill forward again. And I'm sincerely hope that we can find some agreement as we move forward concerning this program. Senate Bill 297 from 2025 was introduced after I was made aware of financial and operational issues potentially challenging the solvency of some of the risk pools operating in New Hampshire. This information has given me great concerns over the viability of some of these entities. The Senate agreed with my concerns and passed Senate Bill 297. However, it didn't make it in through the House. Pooled risk management programs were authorized legislatively in 1987 to allow for political subdivisions to come together to self-insure coverage for their employees in municipal property such as health, property, casualty, and workers' compensation. This bill will go a long way towards protecting the taxpayers, political subdivisions, and their active and retired employees through the addition of much-needed language to provide solvency and financial impairment protections for the pools, ensuring predictability and stability. The bill sets minimum and maximums for contingency reserve, ensuring the pool's success as an ongoing entity while making sure surpluses that are not needed are returned to the member political subdivisions. This section will go into effect in July of 2027. Senate Bill 661 further adds an emergency triggering mechanism that authorizes the Secretary of State to seek a receiver through the court to enforce an immediate assessment of contributions to ensure financial stability and protect New Hampshire's taxpayers, active and retired employees. Unfortunately, I must report that it appears that the political subdivision members of the New Hampshire Interlocal Trust will not see the benefit of this important legislation, as their board has voted to wind up the program and a court has ordered a receiver to protect the tax-paying public along with active and retired workers. This legislation also increases transparency through required disclaimer language for self-insured coverage lines and state that the pools are member-owned. Lastly, it adds 4 new definitions of key terminology that will ensure efficiently run operations. This bill would take effect upon passage, except as I stated earlier, the replenishment of contingency reserves will take effect in July 2027. The Secretary of State, who also serves as the head of the Bureau of Securities, and actuaries are here to answer any questions you might have. And those questions, as you can imagine, are extremely technical, and they could answer those questions better than I could. So thank you very much, Mr. Chairman.
Senators have a question. Senator Waters.
We got it through last time, and here we are. I just wanted to get your thoughts on page 4.
Okay.
About the 12% minimum and 16% maximum, and I see that there's kind of a jigsaw puzzle between the reserves and the extra assessments, but you know, we've heard some concern about this. Is the 16% high enough? And I just wondered what you thought about these numbers.
Well, thank you very much for the question, Senator. This bill is the bill that came out of the Senate. So it was worked on, but it's worthy of a conversation, and we should discuss whether or not that's too low or too high. But what here is what we voted on last year.
Thank you.
Thank you.
Additional questions? Seeing none, thank you very much.
Thank you very much, Mr. Chairman.
All right, Secretary of State, I want to give you the option of testifying now or at the end.
I'll go now, Mr.
Come on up.
Mr. Chairman, I'd like to invite Lance Turgeon, the
Whoever. If we need more chairs, we can do that too. Other side. Okay. And if you both would introduce yourself, I appreciate that.
Thank you, Mr. Chairman. I'm David Scanlon, Secretary of State.
Lance Turgeon, the court-appointed receiver for New Hampshire Interlocal Trust.
Thank you, Mr. Chairman. I'd like to thank Senator Carson for sponsoring this bill. Again, excuse me, and just a refresher, RSA 5B gives the Secretary of State and the Bureau of Securities the oversight of pooled risk organizations. In other words, the Secretary of State is the regulator of these entities. They are designed to allow communities, political subdivisions that don't have the critical mass to self-insure to be able to join with other political subdivisions to create that mass where they can self-insure their employees and retirees for medical insurance and property and casualty insurance. There are currently 3 active pooled risk organizations operating in New Hampshire. That would be Primex, which is property and casualty. It would be School Care, which deals with medical insurance, and Health Trust, also with medical insurance. There are 2 pooled risk organizations that are in run out. They had court-appointed receivers placed on them. One is from a good dozen years ago when there was a reorganization of the local government center, and I believe it was PLT was a workman's comp pooled risk organization that wasn't able to survive, and then more recently NHIT, New Hampshire Interlocal Trust. When we were here discussing this legislation a year ago, I raised concerns about a couple of the pooled risk organizations having some significant financial issues. And a lot has played out in the last year. The first thing that happened was that NHIT it turned out was underwater with their finances. They attempted to make an assessment of their members. The rates that they were charging were as high as 60% increases. And a lot of the members said, we're just going to bail. And so the board of directors of NHIT decided to pull the plug on that operation, at which point we made a very decisive decision to step in and ask the court for a receiver to run out that organization in the best interest of the political subdivisions and the employees and retirees of those political subdivisions. And I'd like to just jump over to Lance Turgeon, who was the receiver that was appointed, just so that he can tell you what happened with that situation.
Yeah, so when I took over, just maybe give a little rundown of NHIT and what happened there. At the start of their fiscal year, there was about 3.7 million in cash and what would have been the contingency reserve of 1.2 million. By December of that year, there was cumulative losses of $2.4 million, and the contingency reserve was, of course, negative at that point at 1.2, and cash was down to 1.7. Then they did this. Then I stepped in April. By April, the cash was down to 700,000. The book contingency reserve was negative $2.5 million, and then by May. And when I kind of got a grasp of the situation, I did have a meeting with the members, did inform them there was a possibility of an assessment coming right there. There could have been a little bit of a run on claims too, because when they announced to close it right there, people want to fill out their prescriptions and so forth right there. But in June, Harvard Pilgrim pended the claims, so they stopped paying the claims except for the pharmacy claims. Those have a PBM, or pharmacy benefit manager that takes care of them, so they couldn't stop those right there. On June 30th, the claims that were pended were about 1.2 million. So these are known claims right there, and the cash on hand was just a little bit under that. So the thing was completely broke at that point right there. And just at the end of June, I did make that assessment in July. Just to make things even more interesting right there, in July, we became aware that there was an organ transplant that was done at the end of the year. Those can run from $500,000 to $1 million. And again, no cash right there without the assessment. At that point, we did have members coming in. They understood what was going on. They paid the assessments. What happens right there is when we are not paying the claims for Harvard Pilgrim, that was our third-party administrator. That is a breach of the contract with them, and they can actually walk away. They were wonderful for us. They worked with us to make it happen. If they did walk away, the trust would have to process its own claims right there, and you lose all the discounts. So the proverbial $10 aspirin is now $10 to the trust, and then. As the groups paid their assessments, I was able to pay some in there. There was a $610,000 settlement the Secretary's office got in there regarding some issues with the administrator right there. That helped the cash. We got it down to about 2 groups that did not want to pay, and one of them was the second largest group. What happened at that point was I started beginning the process of terminating them from the trust to protect the rest of the trust, because if they didn't pay, I wouldn't be able to pay claims, and we're in breach right there. If that would have happened, those members would have gotten their claims back, and that would have been disastrous right there for those people, like employees right there, particularly an organ transplant for $500,000. Do you have that on hand? Obviously not. School Care actually did their assessment right around then, and things fell into place. The other groups did pay that right there, and we were able to pay all the claims through it thanks to that assessment. Happy to say by December, with that 610 that was collected, and the Harvard Pilgrim willing to release an illiquid asset, a security deposit right there, I was able to return half the assessment to the members right there. And in the end, I think we're probably gonna be able to return everything right there, because we were able to collect stop loss and so forth there. There was a very severe cash flow issue right there, and you talk about the reserves and so forth right there, and the importance of that right there. This is probably the hardest job in my 30-year career, to be honest with you, right there, to get this thing to the end.
So I would like to thank Lance for the job that he did, but what we learned here was that this is tough on communities when this happens. And if a community does not pay or cannot pay for the claims that are due, then the health insurance company is going to start billing the individual employees of that community. And as Lance just said, if that was in the case of a transplant, that individual employee would be liable for the $500,000 to $1 million. Anyway, that was a successful successful runoff. Part of the problem why we ran into these issues was that we had probably a once-in-a-lifetime issue with a pandemic, and that kind of threw everything on its head. And along with other factors, like not following actuarial advice, trying to compete with other risk pools by manipulating the prices, and things like that, all drove, they were all part of the equation as to why this thing. I don't want to oversimplify it because there are many other factors, but in terms of school care, if you look at the chart that I passed out, it shows the net position that school care was in at the end of each of their fiscal years. These charts were made by an actuary, by the way. You can see that school care was operating comfortably within the range that is called for in this bill, between 12 and 20%. And then in 2024, they dipped below that line. That would have required notice to the members of the pooled risk organization under the bill that's before you right now. And the members would have been alerted that potentially there's an assessment coming because of the decline in the reserves. By the end of fiscal year 2025, you can see that the rate dropped below 4.4%. That would have raised other alarm bells in terms of actually requiring the assessment to be made so that the pooled risk organization could stabilize. And then what happened what actually happened, as you can see, mid-year on October 31st of 2025, school care was almost $5 million underwater. And they were working with my office, and we sat down with them and provided resources that we have related to actuaries and accountants, and just help the board make the important decisions and the really tough decisions that they had to make to restore the health of that organization. So there was a $30 million assessment that was made to the members, but you can see that brings them pretty close to the bottom line threshold of that range. And hopefully, as they work through this fiscal year, they're going to get above that in a comfortable way. I will say that school care has been very open, transparent, and has worked really, really well with the regulator. The same is true with Primex, although because they're not a health insurance agency, they really weren't affected by the pandemic, and they've been operating just fine. But they work with us very cooperatively and very closely. The next chart that is on here is Health Trust, and it shows their financial position in terms of the net position at the end of the fiscal year. They came to my office in March of 2023 and self-reported that their reserves were in pretty significant decline. And by the end of 2023, they were down to 10 days of operating capital, which is alarming. And they let nobody know about it. They did not let the Secretary of State know about it. As far as I know, they did not let their members know about it. And then they got through that year. And then, as you can see, in 2024 and 2025, their net position has been slowly increasing. but they're still below the threshold range that we think they should be at. And they're far, far, far below, the upper end of the range that they claim their actuary has established for them to hit. We do not have a good working relationship with Health Trust. In my opinion, they don't want to be accountable. They don't want to be regulated. They are not transparent. When we ask them for the information that we believe we need to be a good regulator, we have to fight for it. And so there are a lot of court actions right now for us trying to seek information. There is an enforcement action through the Bureau of Securities right now with a hearings officer dealing with issues that are violations of RSA 5B. And if you look back in the history, you go back 12 years, there was a Supreme Court ruling after another enforcement action that was taken, and the issues that had to be resolved were a number of things. They were keeping very large surpluses in their reserves. The surpluses were being used to subsidize other pooled risk entities that they had in their operation. So political subdivisions that were paying for medical insurance had some of the money that was paid for that purpose given to a workman's comp pooled risk that political subdivision did not belong to. And it just seems that there's a tremendous temptation when these surpluses grow to a certain size to think of other ways to use the taxpayer money. And again, we're talking about $750 million of taxpayer and employee money here. And that's the reason that they need the oversight. And the regulation is to protect the money of our hardworking citizens in New Hampshire. And that's what this bill is all about, to make sure that there is a reasonable range that is established based on standards that are created by people in the industry that know, and that we make sure that there are alarms that go off when reserves drop below certain levels so that we can take action much earlier than we've been able to do. And unfortunately, with the audits that come out, there's a 6-month plus lag time in some of this information that comes out. And by then, the problems are already well on their way to being big problems. This gives us a way to deal with that. I'm going to end there, and I'd be happy to answer questions.
Questions from the senator, Senator Rosenbaum.
Thank you. Not sure where to begin. That was quite some testimony. As I look at school care, even with that assessment, they're below the rate you think is the minimum. And I know that Health Trust has said they think the reserve should be above 34%. But having told us they were on a 5-year plan to rebuild their reserves, I see that they're at 8%. So how likely is it they could get to 34% within 5 years? And wouldn't that be incredibly expensive for their members?
That question is probably better for the Health Trust people than the secretary, because he, as far as I'm concerned, he doesn't have a basis for that. So unless you want to pursue that one before we get to Health Trust, Senator, I would ask you to.
Well,
wait.
I'm just curious about whether these reserve levels are the right levels, given what we've seen happen among these risk pools.
Thank you for that question. Again, these levels, in my opinion, should be up between the 12 and 20%, so that any issues that are coming down the road can be addressed. Now, Health Trust is claiming that they are a non-assessable program where they assume the risk of reserves running out. The only way they can do that is to hold reserves large enough, which would be surplus, to be able to cover those costs if they had a dramatic hit. The bottom line is, regardless of how much money they have on hand at the moment, if there was a catastrophic event that wiped out their reserves, the only option they have is to assess the communities to pay for the claims that are out there. That's the bottom line. And so there's a lot of creativity going on in, you know, how they can build their surpluses up and pay their claims. But the position of my office is that 5B does not accommodate that. That you know, this is a year-to-year thing. The reserve levels have to be high enough based on actuarial expertise to be able to pay the expected claims coming in. And then anything that is above and beyond the reserves and the expenses that's considered surplus is taxpayer money. It should go back to the taxpayers. It should go back to the towns. Now, there is a provision, and Mr. Chairman, I dropped an amendment off in your office earlier today to allow the political subdivisions to hold some of that money in a special account so that if they are required to pay an assessment, they have a pool of money that they manage at their level to be able to pay that. And then the amendment also would create an opportunity for a political subdivision, if they so choose, to allow the pooled risk organization to hold that money in the name of the town and keep it separate, so that the same thing would be true if an assessment was required.
To follow on Senator Rosenwald's question about the 12 and 20%, those numbers, as I understand it, were derived by an actuary that the state hired to do the assessment, and that's what the actuary determined would be adequate. Is that correct?
The actuary that we use came up with those ranges, yes.
In case Senator Rosenwald has a follow-up question, I wanted to.
Well, I
Stay
guess
with her.
I do quickly is that if I look at school care with the special assessment, they're still not at the 12%.
I'm not sure how that's going to play out, but we are mid-year, so I would hope that through the premiums that they are collecting, that before the end of the year, they're going to be up over that range. With school care, the alarm bell should have started going off in 2024, and if that wasn't corrected then, they certainly would have gone off and required action in 2025, well before you know, they hit the point that they were underwater.
Thank you.
Both school care and health trust are here. They will be able to come up and testify. Senator Waters, you were next, and then Senator Lang.
Yeah, thank you, Mr. Chairman. Perhaps I'm just not getting it in the bill, but I you know, Senate Bill 297, which you referenced, is a chart with a 20% maximum, but that bill said 16% maximum, and this bill on page 4 says 16% maximum. So does that 20% come from the 16 plus 4, or what is it?
It comes from the 16 plus 4, and it's the reserve level that either the community can hold or.
Thank you. I just wanted to make sure I had it right. Okay, thank you.
Senator Lang.
So thank you. So regardless what the numbers actually look like, I want to look going forward as if we're starting this all over again, and what we should design it looking like. And so as my understanding, I'm looking at page 3 of the bill, letter G. This applies, I think, to the actual towns or school districts to maintain a 4% reserve fund themselves. So if they get hit with an assessment, they have funding. Is that what that's doing? Is building up a capital reserve fund of their own? So if something like this were to happen again in the future, it's not a direct hit on taxpayer.
Yes.
And then the requirement of that component is that if they fall below that 4%, then at 1% a year, they'll add money back to that capital reserve fund to get back to the 4%. So that's the pragmatic, what happens in a town or a school district.
Yes.
Okay. And if I may, Mr. Chair, follow up.
Certainly.
So then I'm looking at all these 4% and 16s and 12% that spread out through the next letters of this bill. But what that essentially gets to, is, it sounds like a similar process at the risk pool side, right? Of the company that's that's not the municipality anymore, but now the provider of the risk pool. There's a 4% assessment cash that they can hold, if you will. But they're obligated under a capital reserve fund to have 12 to 16% of cash on hand to deal with regular claims and regular process. Is that the pragmatic
Yes.
side of what we're talking about? And didn't we hear when we had this 297 last year that everybody said everything was hunky-dory? That everything was fine, the reserves were fine, that there weren't going to be any issues at all? Isn't that what we heard when we tried to pass this bill last year to try to fix the situation?
So much has happened, Senator, between then and now. I don't recall.
Thank you.
Additional questions from the senators? Seeing none, thank you very much.
Thank you.
I'm going to bring up Health Trust next because they were the ones most talked about in the last testimony. And you didn't actually say you were going to speak, but apparently you do. All right.
I apologize for that.
No problem. I checked the box for you. If you would introduce yourselves.
Scott DeRoche, Executive Director of Health Trust.
And Jean Herrick, I am General Counsel at Health Trust.
All set.
Thank you for the opportunity to testify today. Health Trust strongly opposes SB 661. In respect for the committee, I won't read from my written comments. I know that's the preference, but I will give a narrative to go through some of the things that have been said today and answer some of the questions, and then, of course, be willing to answer questions as we move forward. And I have to say, listening to the testimony, I believe there's a very large misconception or confusion about what is occurring in the state currently. I understood Senator Carson to introduce this bill to prevent what occurred with school care. This, in reality, would mandate by law the model that school care is offering. It is the exact opposite of what is being stated. School care and NHIT both operated in accordance with risk pool practices agreements with the Secretary of State. School care had a risk pool practices agreement from 2012 that they continue to honor even though it's expired. NHIT has a risk pool practices agreement from 2020 that was still active at the time that they closed. They were following the model that the regulator desires. That model included low reserves. As Secretary Scanlon just stated, he sees this as a year-to-year proposition so that risk pools have enough funds to maintain 11 or 12 months of solvency. That is the actuarial methodology that is used. We've seen the reports. That is insufficient. It creates a volatile arrangement. This bill would place into law that requirement and that mandate. Health Trust is the longest operating and largest risk pool in the state of New Hampshire. We predate RSA 5B that was enacted in 1987. We are a non-assessable risk pool. We do operate in a different model. We operate with a solvency period of 5 years, which is very important, not a 1 year, year-to-year proposition. Our actuaries state that we should keep more in funds and reserves than what the Secretary prefers. That has been a long-going battle over the last decade or so. As we talked about in previous testimony, the reserve levels held by risk pools nationally, health risk pools nationally, are between 34 to 38% of annual contributions and reserves. So this means for every dollar that comes in contributions, 34 to 38 cents is held in reserves in case the actuaries' expectations about claims experience differ. That amount is important so that if there is a difference, The pool has the funds to be able to pay the claims. As Mr. Turgeon just pointed out, it is critically important that all claims are paid. Those reserves are what's used to pay the claims. And then in our non-assessable model, we are able to rebuild prospectively, not through a surprise assessment, but through an additional charge, a capital risk charge, onto the upcoming year's rates. That is announced in October. That way schools, towns, counties, municipalities are able to account for it in their budget process, are able to plan for it, and those larger reserves allow for that rebuild to occur over a period of time. Health Trust historically, going back to this COVID period, while we were pressured to maintain lower and lower reserves, we went to the lowest end that our actuaries had in their range. That equated to approximately 20% of contributions. During our lowest year, we dropped down to about 5% of contributions. It was not 10 days of funds on hand. That's a misconception. There's a sheet in your packet regarding that. I believe that misconception, or it was the loose leaf handout that went, I believe that misconception is referring to cash on hand. At the time, we did have approximately that level of cash on hand, but we had over $94 million in total assets on hand, things like ETFs and mutual funds. So we went from 20, dropped down to 5, and our rebuilding as of year end, yes, we were approximately at 8% of contributions. We're now currently halfway through the year at approximately 10% of contributions and continuing that rebuild. We are the only risk pool that as of June 30th did not deplete our reserves. School Care and NHIT, as you heard, did deplete them in that low reserve model that was required by the regulator. We did not deplete reserves. We did not issue surprise assessments. Every claim was paid. Every group was told their rates in a prospective manner. They were able to plan for it and budget for it. And it works. It works when risk pools are allowed to have the proper, adequate reserves to function. So I understand that there are concerns about what occurred with School Care and what occurred with NHIT, and I understand certainly and welcome the desire to improve how risk pools operate within the state of New Hampshire and give further guidance. Risk pools are important. Taxpayers rely upon them. Employees, teachers, firefighters, police officers, everybody you can imagine, DPW relies upon these. They are important, and it's important that there's transparency and oversight. But this effort actually requires the very low reserve level that resulted in the situation that we are in today. And that is an extremely strong concern of ours. Just to be clear, if this bill were to pass, it would outlaw Health Trust's non-assessable model. It would outlaw the reserve level that Health Trust operated at and was able to survive this claims, the only one that was able to not deplete reserves during this process. And it would require member groups to create their own reserve accounts. Related to that, the 4% that it would require member groups to create and fund and maintain on their own would be insufficient. To put it into context, the assessment that School Care issued equated to 12% of contributions. The assessment that NHIT issued equated to 5%. The 4% amount is not sufficient to ensure that the funds are available for groups to pay these assessments in relatively short order in order to ensure that claims are paid. As you may have seen this morning on WMUR News 9, there was an article about a school district in the state that is considering laying off teachers mid-year in order to pay for the School Care assessment.
That organization isn't represented by you, so we'll pass that.
Okay, thank you. I would end my comments by saying that throughout the country, risk pools continue to be viable. We've seen that in New Hampshire. They continue to offer better benefits, better services at lower rates than the commercial sector, thereby supporting our public sector and saving taxpayers' dollars. But this system does need adequate funds and reserves in order to work. Secretary of State has long pushed for risk pools to hold lower reserves, demanding a reserve level that is less than half the national average, and insisting on a maximum 1 year, i.e. year-to-year solvency period. That is too low for the state of New Hampshire. Thank you. Happy to answer any questions.
Questions from the senators? Senator Lang.
couple of questions, Mr. Chair, if I may. This graph that shows a snapshot in time on the 6/30 of each year for the last 5 years, is this accurate?
I have not seen that chart. Was that just distributed by the Secretary of State? I could look at it.
Yeah.
Thank you very much. Yeah, this looks at reserves as a percent of contributions. Looking at it initially right now, I would say this looks to be relatively correct, but there's a couple of important things that I would note. Number one is that first year, the 19.9%. That was a year we were required to give back return of surplus to lower down to that 20% mark. About $57 million was returned to the public sector. And then when you see that low year of 2023, we needed to raise about $60 million at that point in time. So if we were able to just maintain adequate reserves somewhere in the range of the national average, 34 to 38%, you wouldn't have had that volatility. You would have seen reserves stay at the more than sufficient level. The chart going back prior to this is very important, the years that are not shown on here. In your packet is a copy of our annual report. If you open up to near the centerfold, that annual report does actually go back several more years to show our net position. And it looks like this. It's important because this really tells the story of risk pools and health insurance generally, where for many years you had relatively stable claims experience. And so the levels that your actuaries were predicting were more or less sufficient. And so you can see we ended the year right about where it was expected for us to end through our rating, just like that. And that's why you can see in 2015, it ended right at the year. 2016, it was a little low, but we were able to immediately rebuild the following year. And you can see 17, 18, 19 ending effectively right on target. Then you have the volatility of COVID with 2020 and 2021. That red line is the return of surplus that we were required to give back. And then you have that rebound and what's happened with the market with increased claims cost and specialty medications and all of the items that we've talked about. And we were able to use the reserves successfully. They paid every claim. There was no danger of insolvency. There was no concern about people's hospital bills being unpaid. There were no surprise assessments. There were no threats about claims being paid if we didn't get an immediate influx of cash. The reserves worked and we're on a rebuild. What we're asking for today is to be able to retain a sufficient level that if this were to happen again in the future, that we would be able to, again, pay claims instead of having a lower level than what you see in this chart, meaning give back even more money during COVID and then very likely be completely depleted just 2 years later if we had followed the Secretary of State's preferred model.
Follow up?
So again, as I read this, it allows for you to have a 4% assessment pool, set aside in case you had to do an assessment. You could use it, a 16% maximum contingency pool, plus your board member could vote an additional 2% if they want to, bringing it up to a 22% maximum cash on hand, for lack of better phrase, for those things. Is that accurate?
There's a couple of things to break down in there. Yes, it would allow us to maintain 12 to 16% as I understand it. From my understanding, we would have to petition the Secretary of State to have the additional 2%. I think based on our experience, that's a petition that is very likely to fail. We have heard that they consider that to be more than sufficient. The additional 4% as written would be a requirement of the groups. I understand there may be an amendment coming forward that would allow us as a risk pool to hold that. That would bring you to 20. 20 is the level we were at this year before COVID. That was the level we went to 2021. So if the desire is to avoid the volatility, it would not do that. That was the level we operated at. And did we survive? Yes, we did. The other two depleted reserves because they were at a lower level. And so the desire now, understanding the volatility in the market, is to return to a normal level used throughout the country, 34, 38%, 33% is a typical insurance average. The other point that I would note is we determined through our actuaries, Milliman, they're one of the premier actuarial firms in internationally, not just the country. Their analysis, which we've distributed to this committee via email last week, it's posted right on our website, looks at reserves over a 5-year solvency period. That's how we arrived at that number that equated to 20%, right? The secretary has been very clear, and you heard him here today, that he considers risk pool reserves to be a year-to-year solvency proposition. And so even if it were set at 20, 25, whatever the case may be, we would not be able to retain that money. That would be the amount that is the maximum allowed by law, but the other requirement stating that this would be a year-to-year proposition, when you give that to an actuary, they're going to come back with something like a 16% reserve, because you're basically planning to get through the next 11 months. And if you don't have enough funds, you need an immediate source of income, or else you'll have to close, which NHIT did, or you'll have to issue immediate assessments, which school care did. And so there's this issue, not just with the percent that's put into the law, but the methodology itself. Risk pools that operate on a year-to-year basis are referred to as transactional risk pools. There are some that have existed, is my understanding. They're exceedingly unpopular. I don't know how many are still operating within the country. Risk pools plan over a multi-year horizon, because we're here to serve the public sector, and this volatility, exactly what we're talking about, this uncertainty and volatility, isn't something that's acceptable nationwide.
Last question.
Go ahead.
So again, sorry, I gave him.
Oh, yeah, sorry.
No, it's okay.
Distribute that back.
So again, at the end of June 30th of this year, or of 25, you're at 8.1%. And you're asking, your argument or your statement is that you want 30% reserves. And if we were to change it to 30%, wouldn't the assessment bankrupt towns?
No,
To get to that 30%, to get that cash reserve up the way you need it?
Yeah, thank you for that question. So we are rebuilding today. We're rebuilding by adding 5% on top of the rates. So we determine, or the actuaries determine the rates needed to cover claims and expenses in a year. And then there's a very transparently 5% capital risk charge that's added to that rate. That 5% is what's used to fuel our rebuild. The board accelerated that recently to 5.3% in the last 2 rating cycles. So that's the charge. It's been that way for 3 rating cycles now. Groups have heard about it. They asked questions at our public hearing. There's been a lot of discussion. Groups have still found that it's beneficial to stay with Health Trust compared to the commercial market. We've retained just about every member group. They've willingly paid that charge, and they're rebuilding reserves that way. So it would not be a dramatic one-time assessment to get to 30%. When you're planning reserves, you're planning for these 1 in 20-year events, these 1 in 50-year events. And so we experienced one with COVID, and we saw that we went from 20% down to 5%, and we're rebuilding back to what's now 10%. Where we want to continue rebuilding to an appropriate reserve level, the board has targeted 22% as the current level, so that if this were to happen again, we have those sufficient reserves. But yes, this is a multi-year rebuild. We have secured stop-loss reinsurance to protect ourselves during the rebuild period.
Thank you.
Or protect the covered individuals.
Senator Rosenwald.
When was the last year that Health Trust had a 34% reserve level?
So we have not had a 34% level. In New Hampshire, there has been significant pressure, as was just discussed, and you heard from the Secretary of State, to have lower reserves. And so there has been a focus on ensuring that risk pools hold as little in reserves as possible and prioritize return of surplus back to the public sector, so back to the towns and cities, et cetera, et cetera. So as a result of that, our board set the target at the low end of the actuary's range that they build for us. That equates to pretty consistently about 19 or 20% given the year. And so when you look at this chart that says 2015 all the way through, these are dollar values. If you were to convert every one of these, it'd be pretty consistently about 19 to 20%. That was the level we were at. It was sufficient during COVID, or the rebound through COVID. Every claim was paid, no assessment, no cash trap. Now understanding that, understanding the volatility in the market, having lived through one of these 1 in 20 year, 1 in 50 year events, the board has now targeted 22%. the upper end of our actuaries range that they prepare for us equates to 28% of reserves or contributions.
Follow up?
So the way I read this bill, and I think Senator Lang does, is that essentially you could hold 20% without having to ask the Secretary of State for that extra 2%. So isn't that where you want to be?
That is where we were at in the 2020 and 2021. That is not where we want to be. We understand that that level was too low for comfort in hindsight. The board has set the level at 22%, which is still in the actuary's range. I think given the continued volatility in the entire health market, I think that it is likely that the board continues to work with this actuaries to look at the upper end of the target. The range that they prepare is 28% currently today in our methodology. Again, it's published right on our website. And so 20% is where we were. We dropped down to 5%, and now we're rebuilding. We don't want to have that experience again for the member groups and those that we cover. We need to ensure that there's stability, that there's no question of any inability to pay claims or anything along those lines. So the rebuild right now is currently targeted to 22%. I would expect that we target above that in future years, given the continued volatility. Again, as a reminder, the national average factually through AGRIP is 34% or 38%.
Just one more quick one.
Could I just quickly add, in addition
Well,
to answer your prior
Let Senator
question?
ask her next question, and then we'll make sure we get you all the time.
You've told us what the AGRIP averages are, but I think I'm remembering from last week that there was testimony that most states don't regulate their risk pools at all. So it's just kind of like the pools get together and make their own decisions.
They utilize actuaries, qualified actuaries. And so the national average for that same benchmark, it's called contribution leverage. The national average for contribution leverage for the health insurance industry as a whole is 33%. So outside of risk pools, 33%. A healthy insurer holds 33 cents in reserves for every dollar in contributions coming through. We're not talking 1-to-1 or 2-to-1 or anything along those lines. It's 33%. Throughout the country, the public sector demands more stability than the commercial market because of the taxpayer process, the way that you can raise revenue, the ability to respond, et cetera, et cetera. And so risk pools throughout the country work with their actuaries to determine what the appropriate reserve level is to maintain. And depending on how you're measuring it, it's 34 or 38%. So I would say it's directly in line with that industry standard, just a little bit more protection than what a normal commercial insurer would hold to provide that rate stability. And this isn't me stating this. There's a citation on the chart that's also in your packet of Guy Carpenter, who's a reinsurance firm who works with AGRIP, who helped publish the guidebook that's utilized to understand contribution leverage. Those are their statements along with AGRIP related to the reserve level. We're not talking about risk pools building reserves to unfathomable levels. This is still 1/3 of annual contributions. It's a buffer of 1/3. I think it's eminently reasonable. Done with appropriate transparency and reporting, everybody should feel appropriate comfort as to what those funds are utilized for. If there is any concern about misuse or anything along those lines, funds should be returned back to the public sector if you rise above that level. You know, this bill was focused on ensuring that risk pools don't go insolvent, similar to what happened in the state of New Hampshire just over the last few months since we last testified. And so the best protection against that situation is simply to hold adequate reserves in line with national average.
Thank you.
Ms. Herrick?
Thank you. I just wanted to add that the percentages, especially with respect to the maximum, needs to be read in conjunction with other language in the statute. The secretary testified that there were 4 definition provisions that were very important to his enforcement of the statute in this legislation. And the definition of contingency reserves won't do away with the need for an actuarial evaluation. It actually will include an actuarial evaluation, and that those would be limited for the upcoming plan year as may be reasonably established and subsequently required to cover expected and unforeseen and extraordinary claim and administrative losses and liabilities. So that 1 year period that you're looking at for the actuary would limit whether or not the amount of your contingency reserves. And as Scott noted, it's likely that that limit will actually come in below the 20, the 18%, and the 16%, because you can only retain enough for that 1 year.
And just related to that, this is not hypothetical. School Care and NHIT were in risk pool practice agreements with the secretary. That's the interpretation they operated under. Their actuarial reports, if you review them, consider a year-to-year solvency period. They're focused on enough reserves to get through the current year, and that's it. That is not, in our opinion, a sufficient reserve level or methodology to maintain the stability that the public sector needs, and it's certainly not one that our model could operate within.
My turn then, I guess. All right, looking at the chart from Secretary of State, your maximum gain on your reserve was 1.8% in the first period and 1.2% on the next, which means even to get to the 12%, we're talking in excess of several years. Having read your financial reports from before, I haven't gone through. My assistant tells me that was 100 and something pages that you sent me, so I haven't.
I'm
gotten
very
through that
thankful
yet.
for her help to get through all of that.
That you are on a 5-year plan, but I thought that 5-year plan was to get to 16%, but your 5-year plan is going to fall far short of that. Comments?
Yeah, absolutely. I think that's a good observation and a very valid question. So to be clear, in the rebuild plan, the board targeted rebuilding 5% of annual contributions each year. That was accelerated to 5.3%. So it was never a desire to get it all done at once. When we first implemented it, it was viewed as a 3-year rebuild. So 5% first year, 5% second, 5% third. That's 15%. Add that to the 5% you started with, you're back at the 20% target, right? So that was the view. The reality is the healthcare market and claims have continued to spike. And so while we did add the 5% to rates, the claims were higher than the actuarial's expectation and ate into that 5% overage. Now, again, we were able to cover all claims. There was no erosion of the reserve level or anything along those lines. But the practical effect was the rebuild was slower than expected because the claims were higher than expected. That's a reality in the market right now. That's why we're seeing commercial carriers pulling out of certain segments of the market. We're seeing things with the individual marketplace. We've seen Medicare Advantage changes. The costs that are coming through the entire marketplace exceed all expectations. You used to be able to plan for about 5% medical trend in a year. We've had renewals where we've had 14% medical trend and 19.9% prescription trend. And so that 5% that was earmarked to rebuild reserves, the first priority is to pay the claims that come through. And so the actual amount that went to the rebuild, as you said, was about 1.5% to 2% in those early years. I will note that this chart stops after last year. We're in current fiscal year 2026. We do believe that rates are holding through the year. We are actually exceeding the actuarial rebuild for this year. We're at a $10 million rebuild already halfway through the year. That's in line, or I'm sorry, exceeding the actuarial expectations. So we expect to have a larger growth this year as we've adjusted to that volatility in the marketplace.
All right, I'll save any of the other questions I have for that for later. Any of the senators have other? Thank you for your testimony.
Thank you for the opportunity.
School care. When you're ready.
Sure. Good afternoon. My name is Jennifer Burke. I am the School Care Director of Finance. I joined School Care in August of 2024. Prior to this, I worked for 2 of the school districts here in New Hampshire for about 15 years, initially as a human resources director and then as a school business administrator. And I also served on the School Care Board of Directors for about 8 of those years. School Care's Executive Director, Lisa Duquette, is not able to be here today. So Chairman Gray and members of the Senate Finance Committee, thank you for the opportunity to testify. We have provided written testimony, and I'd like to just make a few comments. We appreciate Senator Carson's work on Senate Bill 661 and her intent to strengthen the oversight, transparency, and fiscal stability in pooled risk management programs that serve political subdivisions across the state. Senate Bill 661 takes meaningful steps in that direction. It clarifies fiduciary responsibility for governing boards, strengthens actuarial and audit standards, improves transparency for participating members, and provides the Secretary of State with tools to intervene when a pool shows signs of financial stress. It also appropriately clarifies that pooled risk programs are not insurance companies, and assessments may be required when claims costs exceed expectations. While School Care is neutral on Senate Bill 661 is introduced, we believe the bill would be strengthened by incorporating the amendment language previously offered by Senator Carson during the consideration of Senate Bill 297 last year. That amendment addresses a technical implementation issue related to assessments for health coverage pools. It establishes a limited restricted fund capped at 4% of prior year contributions derived from program earnings and surplus, and it requires that this fund be used first to address actuarially determined deficiencies before assessments are imposed. And it makes clear that the fund does not replace existing reserve requirements, nor does it limit the Secretary of State's authority. The amendment does not eliminate assessments. It simply clarifies the order of operations, promoting predictability and avoiding financial disruption for municipalities and school districts. We respectfully recommend that the committee consider the prior amendment if 661 were to move forward, and we will analyze the amendment that was provided today from the Secretary of State's office.
I wouldn't characterize that as an amendment. I would characterize it as a suggestion.
As the suggestion, and we will analyze the suggestion from the Secretary of State's office. Thank you for that clarification, and thank you for your time and consideration.
Questions? It should be noted that the prior, when we spoke about a school district that is on WMUR, it was School Care that was the provider. So
yes,
just to make sure that we're open and above board on that. Okay, if there's no other questions, thank you very much.
All right, thank you.
All right, as we go through the rest of the list, remember, we're not repeating. We're not reading a testimony that somebody's already made. And if you are an organization that is represented by a risk pool, you should identify that. And if you are an officer in that, you should identify that also. Okay? All right. Kathy Stacy?
Good afternoon. Chair, members of the committee. So my name is Kathy Stacy. I'm the president of the New Hampshire Association of Counties. I will tell you that 4 of my county members are member groups with Health Trust. I have 2 member groups that were with NHIT, which now have chosen, obviously had to go out. and get insurance coverage directly through Anthem Blue Cross. One other one is with Anthem, and 3 of my other counties are self-insured. I am not insured through Health Trust or any other of those entities. Rockingham County is self-insured. So I will not repeat. I had a lot of information, and my balloon has been busted kind of with all the information, but I will be submitting my testimony. But I will let you know that the association's main concern is our belief this bill, along with other bills in committee, intend to eliminate non-assessable risk pool programs. The contingency levels adopted by the regulator for 1 year of reserves and contained in this bill, we believe, are inadequate. Insurance claims will likely continue to rise given the high cost of medical care, and contingency reserve levels must be established that are sufficient to meet those costs. Is pretty much, I'm not going to get into, I wanted to talk about the 34 to 38% and the reserves, and I wanted to talk about the other entities that have an MOU with the regulator, but I understand that I cannot do that. So basically, the association does not support this bill. Thank you.
Questions from the senators? Seeing none, thank you very much.
Good afternoon.
Tara Tucker.
Good afternoon, and thank you for taking my testimony today. My name is Tara Tucker. I'm the town administrator for the town of Greenland. I was previously the police chief for 13 years, so I worked for the town for quite a bit. The town does use Health Trust as their insurer at this time, and I currently just started being sitting on the board of directors. So I'm here testifying as the town of Greenland. The town had Health Trust for years and years. We were approached by an independent insurance company in 2024, and we did change to that insurance company. We are a town of 23 full-time employees, so fairly small. So in order, obviously, to get our business, such a small town, they promised us everything, as you would expect. We were shocked and surprised when it was not what they promised it to be. The employees were paying huge amounts, not just in prescription costs, but also in medical coverage. It was really a nightmare, and we're still dealing with that insurance company. However, we were very lucky in that the Health Trust, we looked through the bylaws, and we were able to petition within the first 6 months of being gone to go back to Health Trust. The town, the Board of Selectmen did that petition. They did accept us back. SB 297 last year came up shortly after that, as soon as we came back to Health Trust. And having been really involved in legislation when I was the chief of police, I was paying attention. The Board of Selectmen asked me to follow it. And as I dug into the different bills that changed and molded last year, both Senator Carson's bill and in the House, it became very clear to me that maybe we don't understand our risk pools as well as we should, being users. So I started digging in and learning. And that is when I requested to be on the board of directors for Health Trust. The next time there was an opening, I was able to join. But my point in joining is that we are New Hampshire. We are unlike any other state in the country. We have so many small towns. Greenland is 4,200. We're right beside Portsmouth. We have 95, so we have a huge amount of influx going through, but we're a small town, like most of your constituents, I would imagine. And for us to be able to go in any other direction than a risk pool and get solid, dependable coverage is not realistic. We have to have this risk pool in order to have any say. Healthcare has gotten crazier by the day, but if we're going to try and retain employees and recruit employees, it has to be through decent benefits and be able to answer to the taxpayers for basically rates that are going to stay the same. We can't have the volatility. In my town, there is, I don't know how we would do an assessment. Some of these towns that have felt these assessments from the other risk pools, it's shocking to me, the ones that have been able to come up with the money. Because our taxpayers, we really run a tight budget. I'm sure like the state, it's very, very tight. There isn't, you know, an extra $400,000 somewhere. There's not an extra $40,000 somewhere. So if it wasn't non-assessable, we couldn't do that. We also, to hold 4% would be very, very difficult for us as well, because what we're paying for with a 5% increase, let's say, with a health trust, is we're paying for the guarantee that we won't get an assessment. We're not going to have a sudden $10,000 bill. Absolutely not. And so to go through that, if they have to hold higher reserves in order to do that, in order to be able to represent the small towns and the taxpayers in keeping things, I don't want to say stagnant, but plateaued, it has to be something that can be handled. So I'm asking, you know, the Board of Selectmen and the taxpayers of my town, beg you to understand that this is kind of our only option. You go to a Manchester or Portsmouth, I'm sure that they have enough that they could maybe do something outside of a risk pool, but we're very limited. So I appreciate the opportunity to come before you today.
Questions from the senators? All right, let me run one scenario by you.
Yes, sir.
They're adding 5.13%, is it?
5.3.
5.3%. The building up of the 4% is only 1% a year, which is better for you.
You're right, but if that doesn't guarantee, that still doesn't guarantee we're not going to get an assessment. So
I'm just, you know, that this thing is very complicated.
it is very complicated.
And if they were trying to build to a 34%, then those numbers become very, and again, I don't want to go into what we are going to talk about in executive session, but just the complication.
I completely understand. I think that having reserves is one thing. Having oversight is very important. Having a regulator is very important. So perhaps there is something in between 20 and 34. Perhaps there is something that can still offer towns the protection of having a non-assessable risk pool for us to be able to get insured.
Okay, thank you very much.
Thanks very much for your time.
And off the record, I'm also police commissioner in Rochester. You may be mad at me right now.
You are, actually, I am. I take back any nice thing I said.
Jennifer Leonard. Just so everybody knows that the police commissioner has just hired a couple of officers. Well, I know the numbers. Believe me, I do know the numbers. Jennifer.
Thank you. Good afternoon. My name's Jennifer Leonard, and I'm the HR manager at Manchester Housing and Redevelopment Authority. We're the largest public housing agency in northern New England. We have been a group member of Health Trust for decades. It's been over 20 years when I tried to research how long it's been. Throughout the country, risk pools continue to be viable through unexpected claim spikes, offering stable and lower rates than the commercial market. We at Manchester Housing depend on Health Trust remaining a non-assessable risk pool, and we take comfort in their adequate reserves that have covered any volatility in the healthcare market on behalf of their members for years. Sufficient reserves result in a stable and protective experience for group members. Health Trust remains the only risk pool in New Hampshire that's never issued a surprise assessment to its group members due to insufficient contingency reserves. We at Manchester Housing, as an independent public nonprofit, our budgets are very tight. We would never be able to suddenly take on a surprise assessment, as happened with the two other assessable risk pools in New Hampshire last year. Only in New Hampshire are there discussions about mandating insufficient reserves or outlawing non-assessable risk pools. I respectfully urge you to vote no on SB 661.
Questions from the senators? Seeing none, thank you very much. The last one on my list, at least this copy of the list, is Margaret Burns.
Good afternoon. I'm
Good
Margaret
afternoon.
Burns, Executive Director of the New Hampshire Municipal Association. We represent all 234 cities and towns, and we also have many associate members that are counties, regional planning commissions, and village districts. Most of my members are a member of one or more risk pool, whether it be a healthcare risk pool, Primex as their property liability risk pool, or both. The New Hampshire Municipal Association is also a member of a risk pool. We are also a member of Health Trust. NHMA opposes Senate Bill 661 for three major reasons. One, it allows only one model of risk pool. It allows only assessable pools. Two, it creates unpredictability and additional costs in municipal budgeting. And three, it creates a new mandate for municipalities. On the first point, I agree with prior testimony from Kathy Ann Stacy and from Health Trust regarding essentially outlawing non-assessable pools, which is what Health Trust is. But I also wish to add on to that there is a reason and there is a purpose for allowing more than one risk pool to operate, giving political subdivisions a choice of what type of pool they believe best suits their needs and what level of risk essentially they want to take in joining a pool if they choose to be a member of a risk pool at all. On the second point, with regard to unpredictability and additional costs in municipal budgeting, let's assume for a moment that although current RSA Chapter 5B does not actually reference assessments, let's assume that in our state, both assessable and non-assessable pools are allowed and that assessments are allowable under current New Hampshire law.
Not to interrupt you, but that's a subject of a court decision right now, right?
A court decision?
Well,
An administrative
it is in front
enforcement
of the court
action?
right now.
It is in front of an administrative hearings officer of the Secretary of State's office. That is correct. Thank you. Where I was headed with that is that regardless of the accessibility of pools, political subdivisions who received assessments over the past year clearly were surprised to receive those assessments and were not prepared necessarily to pay those assessments. And so while that certainly necessitates clarifying the law so that members who are members of assessable pools know that that is a possibility and how that will work, it does not justify making non-assessable pools not allowed here in New Hampshire. On my final point, it establishes a new mandate for municipalities. It does require municipalities to establish capital reserve funds at the local level for the purpose of paying unexpected assessments. I wish to note on that regardless of the requirement that the municipality establish a capital reserve fund, that still does not mean the capital reserve fund will hold enough money to pay an assessment, as municipalities cannot know when an assessment is coming or what the total dollar amount of the assessment will be. In towns, capital reserve fund funding is still contingent on the town meeting approving it, so it's not a sure thing that funds will be put into a capital reserve fund. And on a purely technical point, I wish to simply mention that these would not be capital reserve funds. They are not capital expenditures. They would be more properly qualified as reserve funds. Two more points that I would like to make, Mr. Chairman, is that unless I missed it, as compared to last year's Senate Bill 297, Senate Bill 661 does not contain the provision that allows the regulator to step in and require an audit if the risk pool fails to do one. Given the financial allegations against the risk pools, that would actually seem to be an important provision a power that the regulator would have to ensure that an audit is always completed, and so that both the regulator and members are able to see an audit and the financial status of the risk pool. My final point and my final concern about Senate Bill 661 is we heard testimony that part of the purpose of this bill is to respond to the scenario with school care and NHIT and to prevent that sort of scenario from happening again. I simply wish to point out that the language of Senate Bill 661 is in fact codifying that process. It is codifying that all pools will be accessible, and by putting the reserve levels where they are, almost ensuring that assessments will become routine for municipalities who are members of risk pools, or at least members of healthcare risk pools. So for those reasons, we are opposed to the bill. Thank you.
Questions from the senators? Senator Rosenberg.
Thank you. If the risk pools, I don't know how to put this nicely. If the risk pools did a better job of setting their member contributions, wouldn't it be less likely that there would need to be an assessment?
I think I'm having trouble with a better job of setting, because as I understand it, both being a member of a risk pool and attending annual hearings to understand the rate setting process, and also having to dive into the process because of the legislation that's happened in the past couple of years, they are working with actuaries who are making predictions essentially, and that is what is being used to determine those rates. And we've heard testimony from both pools in this hearing and in other hearings that the predictability of healthcare costs, of healthcare claims is becoming more and more volatile, and that is a factor here in setting rates. But it's also a factor in wanting to ensure that reserves can hopefully withstand that volatility. So I'm not sure I can answer the part about the better job on setting rates, but I'm trying to.
Could I follow up? Perhaps by better, I mean, if they weren't as concerned with competing against the other risk pools and having lower member contributions. Maybe that's what I mean by better. If they were more accurate in what they really thought they were going to need to cover their claims costs.
My sense has been that is their main motivation, is being accurate in what they need to cover their claims and administrative overhead and to serve their members with all the services that the risk pool provides. So I guess that's the best answer that I can give on that. I apologize.
Thank you.
My turn.
Mr. Chairman.
As I look at the charts that were passed out by the Secretary of State, and I don't think you got,
I did not.
but that there is, if there were a requirement to, when you were below the 12%, to recover to at least the 12% in 1 year or 2 years, for the testimony of Health Trust, because they're under a 5-year model, and from looking at their reports of their various meetings, it went from 91 million to 140 million. That's a year-old data that's running around in my head, so don't, would that not be a better way to make sure that I don't have an assessment?
Your question is if they were rebuilding at 1% per year. I apologize.
If
There's a
they
lot
were
of numbers
required-
for me in this hearing. I
If
apologize.
they were required to rebuild in either 1 year or 2 years to the 12% level, would that not also make sure that, or would it lessen the chances that there would be an assessment?
I don't think it would lessen the chances that there would be an assessment, because I'm going to look at recent events And recent events, we heard in testimony last week on Senate Bill 605, we heard that school care was at roughly 12% before they went into the negative 2%, which necessitated the $30 million in assessments that they issued. So again,
After the hearing, come take a picture of that.
I would be happy to, Mr.
And
Chairman.
and you will see that they weren't at the 12%.
That is what I heard in the hearing. I apologize.
All right, anyone else have any questions? All right.
Thank you.
Seeing none. There's two people who signed up in support, did not wish to speak. I don't see the firefighters here, so, and online there were 3 in support and 39 in opposition. Is there anyone else that didn't testify that feels they have to? I won't speak about Nichols right now because nobody understood it, so. All right, with that, we'll close the public hearing and I'll go into a brief executive session. If you guys have a motion, do I have a second to go in motion and a second to go in executive session? All those in favor say aye. Aye. All those opposed say nay. We're in executive session. Certainly not going to try to take action on any of the bills, but I did want to give you guys the opportunity to talk if you wanted to. Senator Waters?
Yeah, if I just mentioned that, I'll mention that Senate Bill 608, I do have that amendment.
Okay.
Should be good to go, answering the reasons why Senator Rosenwald brought it in here. My bill on the education freedom accounts, the amendment obviated the fiscal note, so I just wanted to point that out to you, Mr. Chairman. But on this bill, I did have one question. You know, I looked at Senator Carson's amendment from last time and tried to see what was in and what was out, and I think maybe the audit was in there, but I don't remember. So I didn't know whether that was something that you're going to go through to see what was going to be maybe needed to be added to this.
We can certainly look at that.
Okay, thanks.
And we can look at the percentages. We can look at, whether a supermajority of the members, can authorize a higher percentage than the 4% or other things to try to get to. But I do believe that, if a risk pool, I look at the 5-year plan that was, or actually, I guess in your notes, it was a 3-year plan of your, and that, doing the 5%, but it hasn't come out that way, that also would reduce, in my math, that it would reduce that 34% down some, not having to return money other than to put it in an account that they maintain might have something bearing on this. I think that there is, but it needs to be done in the spirit of cooperation. Okay? It is not to the advantage of any of the members of risk pools, in my opinion, to stay with the current language because it hasn't worked. So we need to get to something that will work. Okay? And that needs cooperation from the members of the risk pool and the Senate, and then ultimately the House, which we know that a certain chairman of a committee that this went to last time has a different opinion than the Senate does. Senator Rosenwald.
Thank you. Do we know anything about the timing of the administrative hearing action when former Speaker O'Brien might issue some ruling?
I don't know, and I would have to ask the Secretary of State as far as I know if he knew, but I have no knowledge.
Maybe we can find out.
Certainly we can try. Senator Waters.
One other thing, and kind of following up what you were mentioning, I did wonder about the issue about the return of the surplus and whether it might be possible to smooth that out over a year or two, in effect making it into a kind of contingency so that maybe they don't give it all back each year, but have a couple of years glide on it, or they return interest earned on it to the municipality. But I'm just wondering if that's another way to kind of crack the nut of how much.
In the bill from last year, there was a possibility, as I
Yeah.
remember, that could be part
Yeah.
of your 4% and build that up.
Yeah.
And again, if you give the risk pools the ability with a supermajority vote to hold even more than that 4%, then that may be a way to get there.
Thank you. That's
But
what
I
I'm trying to
don't know
remember.
that,
Yeah.
that I'm willing to go all the way to give them a 34%. And, that's, but we will discuss that as we go through the bill. All right, anybody else before we come out? We still have a bunch of bills we need to exec. We didn't get too awfully far this time, and I haven't even started the second committee bills yet. So we have a motion to come out of executive session. You have a second. All those in favor say aye. Aye. All those opposed say nay. The ayes have it. We are out of executive session and our business of the day being complete. We are adjourned. Margaret, if you want to come up and take those pictures.